Imagine waking up one morning, making your usual cup of coffee, and then stopping mid-pour, unsure if you already added the sugar. Harmless? Maybe. But what if it keeps happening? What if you're suddenly forgetting appointments, misplacing your keys, or struggling to find the right words? Now here's the shocking part. For millions of seniors, this creeping memory loss might not be just aging at all. It could be coming from the very medications you trust to keep you healthy. Hi, I'm Dr. Michael Anders, clinical geriatrician, neuropharmacologist, and researcher for over 30 years. And what I'm about to reveal could change how you think about memory loss forever. Today, we're diving deep into seniors. Warning: 8 medications that cause severe dementia. These aren't obscure drugs. They're some of the most commonly prescribed pills for heartburn, anxiety, insomnia, depression, allergies, and high cholesterol, quietly eroding brain function in ways most doctors don't fully warn you about. This is not about fear. It's about facts, science, and solutions. Because research from Harvard, the Mayo Clinic, and the University of Washington now shows that prolonged use of certain medications can double your risk of memory loss, confusion, and even dementia. And a major study in JAMA Internal Medicine found a 54% higher risk of dementia in older adults who took certain meds daily, even after they stopped. So what are these medications? Why do they harm the brain? And most importantly, what are the safer alternatives? Stay with me. In this video you'll learn the exact 8 medications linked to cognitive decline, the latest scientific findings behind the damage, real-life stories from patients who reversed course just in time, what to ask your doctor and what to do starting tonight. So if you're over 60, caring for a loved one, or just serious about protecting your mind, this is the video you cannot afford to skip. Smash that like button, hit subscribe, and turn on the notification bell so you don't miss a single breakthrough on senior brain and body health. Drop a comment below if you've ever experienced brain fog or forgetfulness and want answers. We'll respond personally with insight. Ready to take control of your cognitive future? Let's move to number 1. Proton pump inhibitors, PPIs, and memory loss. Proton pump inhibitors, or PPIs, such as omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix, are commonly used to treat acid reflux, GERD, and peptic ulcers. These medications work by blocking an enzyme in the wall of the stomach that produces acid, offering rapid relief from painful symptoms like heartburn. However, what many patients and some healthcare providers fail to realize is that long-term use of PPIs is associated with significant neurological risks, including memory impairment and dementia. Let's break down how and why. The science behind the concern. PPIs interfere with the body's ability to absorb vitamin B12, a crucial nutrient for maintaining neurological function. B12 deficiency can result in irreversible nerve damage, cognitive fog, and confusion. In a landmark study published in the journal JAMA Neurology, 2016, researchers followed over 73,000 individuals aged 75 and older. They found that regular use of PPIs was associated with a 44% increased risk of dementia. While observational in nature, this study controlled for multiple confounders, including baseline cognitive function, cardiovascular disease, and lifestyle factors. Further research from the Journal of the American Geriatric Society, 2015, reported that prolonged PPI use, defined as more than 2 years, significantly increased the odds of developing B12 deficiency by 65%, especially in adults over 60. The implications for brain health are clear. Sustained PPI use without appropriate monitoring may create a silent, progressive cognitive decline. Gut-brain axis disruption. Another factor is the emerging science around the gut-brain axis. By reducing stomach acid, PPIs can alter gut microbiota, our intestinal ecosystem, which plays a pivotal role in producing neurotransmitters such as serotonin and dopamine. Changes in microbial balance have been linked to increased risk of anxiety, depression, and cognitive dysfunction. A 2020 study published in Frontiers in Aging Neuroscience found that elderly patients on chronic PPIs had reduced diversity of gut bacteria and higher levels of systemic inflammation, 2 markers strongly associated with neurodegeneration. A real-life story. Barbara's awakening. Barbara, a 66-year-old retired librarian, had taken omeprazole daily for nearly 4 years to manage acid reflux. Slowly, she began to experience word-finding difficulties, forgetfulness, and mood swings. Her daughter noticed she was repeating stories and seemed withdrawn. An evaluation revealed borderline B12 deficiency and early signs of mild cognitive impairment. Her geriatrician, informed by recent research, recommended tapering the PPI, supplementing B12, and switching to a combination of lifestyle changes, elevated bed positioning, reduced late-night eating, and a Mediterranean-style diet. Within 8 months, Barbara reported clearer thinking, improved memory, and better energy levels. While not a cure-all, removing the chronic PPI and addressing the nutrient deficiency gave her the clarity she thought she had lost for good. Practical alternatives for acid reflux, short-term use only. If PPIs are necessary, they should be used at the lowest dose for the shortest duration possible. H2 blockers. Medications like famotidine, Pepcid, have a lower risk profile for long-term cognitive effects, though they should still be used judiciously. Natural remedies. Consider ginger, slippery elm, and deglycyrrhizinated licorice, DGL, which have been shown to soothe gastric irritation. Lifestyle measures. Eat smaller meals, avoid lying down within 2 hours of eating, reduce alcohol and caffeine, and elevate the head of the bed. Key takeaway: PPIs offer powerful relief for acid-related conditions, but they are not without neurological consequences. Long-term use without monitoring can quietly impair cognitive function, especially in older adults. The solution isn't panic, it's awareness, education, and partnership with your healthcare provider. Let's move to number 2. Anticholinergic medications and their cognitive impact. Let's now turn to a group of medications that are, without exaggeration, among the most quietly dangerous to the aging brain: anticholinergic drugs. These medications are commonly prescribed to treat a wide variety of conditions, from seasonal allergies to urinary incontinence and depression. At first glance, they may seem entirely harmless. Some are even available over the counter. But what many people, and even some physicians, overlook is the profound impact these medications can have on memory, learning, and cognitive resilience, especially when taken regularly over long periods. The role of acetylcholine, memory's master switch. To understand the risk, we need to understand what these drugs do. Anticholinergic medications block the action of acetylcholine, a key neurotransmitter in the brain responsible for memory formation, attention, and muscle coordination. Acetylcholine is essentially the spark plug of cognition. Without it, neural circuits become sluggish, memory formation falters, and information recall suffers. This isn't just theory. Decades of neuroscience research has established that acetylcholine is the most critical neurotransmitter involved in short-term memory and learning. It's no coincidence that many Alzheimer's drugs work by increasing acetylcholine levels in the brain. Now imagine what happens when we chronically block that same chemical through medication. Scientific proof. The dementia link is real. One of the most pivotal studies on this topic came out of the University of Washington and was published in JAMA Internal Medicine in 2015. It tracked over 3,500 adults aged 65 and older for more than 7 years. The researchers found that those with the highest cumulative exposure to strong anticholinergic medications had a 54% higher risk of developing dementia, even if they had stopped taking the drug years earlier. This was not a small, casual association. The study adjusted for confounding factors like age, depression, and cardiovascular disease. The conclusion was clear: the risk accumulates quietly and is potentially irreversible. Another 2021 review in the Lancet Neurology identified anticholinergic burden as a modifiable risk factor for dementia, concluding that reducing use in older adults could prevent thousands of new dementia cases each year. Medications you might not suspect. So, what are these medications? You may already be using some of them without realizing the risk. Common anticholinergic drugs include diphenhydramine Benadryl, a first-generation antihistamine found in many sleep aids. Amitriptyline, a tricyclic antidepressant still used for pain and depression. Oxybutynin and tolterodine, used for urinary incontinence and overactive bladder. Chlorpromazine, an older antipsychotic sometimes still prescribed in psychiatric settings. These medications share one trait: they cross the blood-brain barrier and reduce acetylcholine activity. While a single use is unlikely to cause harm, chronic use, even at moderate doses, can gradually erode cognitive function. MRI evidence. What happens inside the brain? Advanced neuroimaging studies have shown that chronic anticholinergic users tend to have smaller brain volumes and lower glucose metabolism in regions tied to memory, especially the hippocampus and temporal lobes, areas often impacted early in Alzheimer's disease. A study from Indiana University School of Medicine, published in JAMA Neurology, 2016, used PET scans to demonstrate that older adults taking strong anticholinergics showed reduced brain metabolism and poorer cognitive test performance compared to non-users. Real-life case, Helen's story. Let me share the story of Helen, a 70-year-old retired nurse who began using diphenhydramine nightly to help with sleep. Around the same time, she also started on oxybutynin for bladder control. Over the next 3 years, her family noticed changes. Repeating herself, misplacing items, struggling to find words. An evaluation revealed mild cognitive impairment, and her medication list was the red flag. Her geriatrician, familiar with the research, tapered her off both medications and introduced safer alternatives. Within 6 months, Helen's mental clarity improved. While not a complete reversal, the change was noticeable and likely helped delay more severe decline. Safer alternatives exist. Fortunately, safer options are available. For example, second-generation antihistamines like loratadine, Claritin, and cetirizine, Zyrtec are far less anticholinergic. SSRIs like sertraline or citalopram may be safer for depression or anxiety compared to tricyclics like amitriptyline. Pelvic floor therapy or newer bladder medications like mirabegron may reduce the need for anticholinergic bladder drugs. If you're using any of the older medications on a daily or nightly basis, especially after age 60, speak with your doctor. Do not stop abruptly, especially with antidepressants. But ask, is there a safer option for my brain? Final word, awareness is prevention. As a physician and researcher, I've seen the tragic consequences of cognitive decline, and I've seen patients stabilize or even improve when anticholinergic burden is reduced. The brain has more resilience than we give it credit for, but only if we stop feeding it what slowly harms it. Don't assume memory loss is just getting older. It might be your medication, and that means it can be changed. Let's now move to number 3, corticosteroids and brain health, a double-edged sword. Corticosteroids such as prednisone, dexamethasone, and methylprednisolone are among the most powerful anti-inflammatory tools in modern medicine. From treating autoimmune diseases like lupus and rheumatoid arthritis to managing asthma flares and severe allergies, these drugs can be life-saving. But there's a hidden cost, one often overlooked in the rush to control inflammation. When used long-term, corticosteroids can profoundly alter brain function, shrink memory centers, and even accelerate cognitive decline. Let's look at what the science says and what you absolutely need to know if you or a loved one is on these medications. The science. Cortisol, neurons, and the hippocampus. Corticosteroids mimic cortisol, the body's stress hormone. In small doses and short bursts, cortisol helps us survive. But chronic exposure, whether from stress or medication, can be neurotoxic. Research from the University of Bristol and the Karolinska Institute has shown that prolonged corticosteroid exposure directly impairs the hippocampus, the brain's memory hub. In animal studies, chronic corticosteroid use led to dendritic retraction and even neuron death in the hippocampus. A major review in Current Alzheimer Research, 2015, confirmed that elevated glucocorticoids are linked to hippocampal atrophy, memory loss, and increased amyloid beta accumulation, one of the key pathological features in Alzheimer's disease. Real-world data, corticosteroids and dementia risk. A large UK biobank study, 2022, analyzing health data from over 500,000 participants, found that individuals with long-term oral corticosteroid use had a 33% increased risk of cognitive impairment and a significantly higher prevalence of anxiety and depression. The longer the duration and higher the dose, the worse the outcomes. In a landmark cohort study published in BMJ Open, 2017, patients with asthma or COPD who used systemic corticosteroids for more than 6 months had an increased incidence of dementia and psychiatric complications, including mood disorders and psychosis. Mechanism of cognitive harm. Corticosteroids disrupt the delicate balance of neurotransmitters, particularly glutamate and GABA, leading to neuronal excitotoxicity. They also reduce brain-derived neurotrophic factor, BDNF, a protein crucial for maintaining neuroplasticity, learning, and memory consolidation. Worse still, corticosteroids impair sleep architecture, reducing REM sleep, another blow to memory consolidation and emotional regulation. Helen's story. From clarity to confusion. Helen, a 65-year-old woman with severe rheumatoid arthritis, was prescribed prednisone daily for nearly 2 years. While her joint pain improved, her mind didn't. She began misplacing items, losing track of conversations, and eventually forgot her own daughter's birthday. Her neurologist ordered a cognitive assessment and MRI, revealing mild cortical atrophy and early signs of memory dysfunction. The team coordinated with her rheumatologist to taper prednisone, introduce methotrexate as a steroid-sparing agent, and refer her to a cognitive rehabilitation program. Within 8 months, her cognition stabilized. While she still needed occasional low-dose steroids for flares, her daily dependence was broken, and so was the steady decline in her memory. Practical steps for safer steroid use. Use the lowest effective dose. Always aim to minimize dosage and duration under medical supervision. Consider steroid-sparing agents. Disease-modifying therapies, e.g. methotrexate, biologics, can reduce the need for long-term steroids. Monitor mental health closely. Watch for changes in mood, memory, or sleep. Nutrition and supplementation. Antioxidants, e.g. vitamin C, E, magnesium, and omega-3s may buffer some neurotoxic effects. Cognitive screening. Periodic neuropsychological evaluations for long-term users over 60 can detect early impairment. Expert opinion. Warnings from the frontline. Dr. Stuart Udofsky, professor of psychiatry at Baylor College of Medicine, explains, corticosteroids are powerful, but in geriatrics, power must be wielded wisely. Chronic exposure alters mood, memory, and motivation, often insidiously. Similarly, Dr. Bruce McEwen, the late neuroscientist at Rockefeller University and a pioneer in stress hormone research, warned, the brain is the most sensitive target of glucocorticoids. Excessive exposure, whether from stress or steroids, reshapes it, sometimes irreversibly. Key takeaway. Corticosteroids can save joints and lives, but when used chronically, they can steal memories, sleep, and emotional balance. The key is balance, using them only when needed, exploring safer alternatives, and always pairing treatment with vigilance for cognitive side effects. Let's now move to number 4. Benzodiazepines. The soothing sedatives that steal memory. For millions of people struggling with anxiety, insomnia, or panic attacks, benzodiazepines offer a lifeline. Drugs like alprazolam, Xanax, lorazepam, Ativan, diazepam, Valium, and clonazepam, Klonopin, are frequently prescribed for their fast-acting sedative effects. They calm nerves, ease muscle tension, and promote sleep. But behind the short-term relief lies a growing body of evidence. When used long-term, benzodiazepines may cause irreversible cognitive damage. As a doctor who has worked with both psychiatric patients and aging adults for over 30 years, I've seen this story unfold again and again. The person who began benzos just for sleep and gradually loses track of words, memories, even their sense of time. Let's explore why. How benzodiazepines work, and why that matters. Benzodiazepines enhance the activity of GABA, gamma-aminobutyric acid, the brain's primary inhibitory neurotransmitter. This action quiets down overactive circuits, producing feelings of calm and sedation. But here's the problem. In the aging brain, GABA systems are already in delicate balance. Prolonged stimulation by benzodiazepines can dysregulate natural signaling, leading to reduced neuroplasticity, blunted memory encoding, disrupted REM sleep, the phase most critical for memory consolidation. The longer the exposure, the greater the risk. And for older adults, whose brains are already more vulnerable, even short-term use can leave long-term scars. The scientific evidence, benzos and dementia risk. A widely cited BMJ study, 2014, analyzed over 8,000 older adults and found that those who used benzodiazepines for more than 90 days had a 51% increased risk of developing Alzheimer's disease. Even after adjusting for anxiety and sleep disorders, the association remains strong. A follow-up review in Current Alzheimer Research, 2018, suggested that long-term use may double the risk of developing dementia, especially with higher doses and longer treatment durations. Neuroimaging studies show that chronic benzodiazepine users often have reduced hippocampal volume, the same region first damaged in Alzheimer's disease. Real-world case, Frank's descent into fog. Frank, a 72-year-old retired accountant, began taking lorazepam to cope with insomnia after his wife passed away. Just a crutch, he told his physician. 3 years later, his family noticed that Frank often repeated himself. He became more withdrawn, forgetting details of conversations and frequently losing items. Neurocognitive testing revealed significant deficits in short-term memory and executive function. When his primary care physician reviewed his medications, the chronic use of lorazepam stood out. Under supervision, Frank was tapered off benzos and began cognitive behavioral therapy for sleep. His sleep remained challenging, but his alertness and orientation improved, and more importantly, the decline stabilized. Frank reflected, "I never imagined the very pill that helped me sleep was slowly dimming my lights." Why benzodiazepines are particularly risky for seniors. Slowed metabolism. Drugs stay in the system longer, leading to accumulation and heightened side effects. Falls and fractures. Sedation increases the risk of nighttime falls, a leading cause of hospitalization in seniors. Sleep architecture disruption. While benzos may induce sleep, they reduce deep and REM sleep, both vital for cognitive repair. Dr. Christine Yaffe, professor of psychiatry at UCSF and one of the world's foremost dementia researchers, notes, "There is growing and consistent evidence that benzodiazepines impair cognition, particularly in older adults. Safer alternatives should always be considered first." Practical steps and safer alternatives. Tapering and transition. Never stop benzodiazepines abruptly. Work with your doctor to taper slowly over weeks to months. Non-pharmacologic therapies. Cognitive behavioral therapy for insomnia, CBTI, shown to be more effective than sleeping pills in the long term. Mindfulness-based stress reduction, MBSR. Exercise and light exposure to regulate circadian rhythms. Natural sleep aids, melatonin, valerian root, magnesium glycinate, but always under supervision if other meds are involved. Short-term use only. If benzodiazepines are necessary, use the lowest dose for the shortest time possible. Ideally, no longer than 2 to 4 weeks. Key takeaway. Benzodiazepines can provide profound relief during moments of intense anxiety or loss, but when taken over months or years, they may steal far more than they soothe. They can erode sleep quality, memory, and emotional clarity, especially in seniors whose cognitive reserve is already stretched. Awareness is power. Ask questions, explore alternatives. Because a calm mind should not come at the cost of a fading one. Let's now move to number 5. Amphetamines and first-generation antihistamines, the surprising culprits behind cognitive decline. At first glance, amphetamines and over-the-counter antihistamines may not raise red flags. Amphetamines are often hailed for their focus-enhancing abilities in ADHD, and antihistamines are go-to remedies for allergies and the common cold. But dig deeper, and a disturbing truth emerges. These seemingly routine medications may carry long-term consequences for brain health, especially when misused or overused. Let's unpack the science behind both. Amphetamines, the double-edged sword of focus. Amphetamines like Adderall, amphetamine dextroamphetamine, and Ritalin, methylphenidate, are central nervous system stimulants, commonly prescribed for attention deficit hyperactivity disorder, ADHD. In the short term, they increase dopamine and norepinephrine levels in the brain, enhancing concentration, alertness, and executive function. But what happens with prolonged use? The risks. Chronic exposure to amphetamines, especially at high doses or without strict medical oversight, can lead to neurotoxicity. Overstimulation of dopamine pathways can damage brain cells. Impaired memory and cognitive flexibility. Animal studies published in Neuropharmacology 2017 show that chronic amphetamine exposure alters synaptic plasticity in the prefrontal cortex, the region essential for decision-making and attention. Addiction and mood instability. A review in JAMA Psychiatry noted that adults using stimulants for extended periods may experience emotional blunting, increased anxiety, and diminished working memory. A longitudinal study published in Molecular Psychiatry 2019 followed young adults using prescription amphetamines and found significant thinning of the orbitofrontal cortex, a region associated with impulse control and cognitive processing. Dr. Nora Volkow, director of the National Institute on Drug Abuse, warns, while stimulants are effective for ADHD, misuse or long-term exposure at high doses may pose risks to brain structure and cognitive longevity. A real-life wake-up call. Liam's story. Liam, a 65-year-old former educator, had been using Adderall for adult-onset ADHD since his early 50s. Though it initially helped his productivity, over time he began forgetting names, misplacing papers, and losing focus. MRI scans revealed decreased activity in his frontal lobe. With his neurologist's help, Liam transitioned off stimulants, incorporated structured routines, and began memory-supportive cognitive therapy. Gradually, he regained clarity, though not all functions returned to baseline. First-generation antihistamines, the hidden anticholinergics in your medicine cabinet. First-generation antihistamines like diphenhydramine, Benadryl, and chlorpheniramine are commonly used for seasonal allergies, colds, and even as sleep aids. They are inexpensive, widely available, and deeply problematic for aging brains. Why? Because they block acetylcholine, a neurotransmitter vital for memory formation and learning. That places them in the anticholinergic category, much like some antidepressants and bladder medications. What the research shows: a 2015 study in JAMA Internal Medicine linked long-term use of strong anticholinergics, including first-generation antihistamines, to a significant increase in dementia risk, up to 54%. In addition, a meta-analysis published in Age and Aging, 2018, confirmed that chronic use of first-generation antihistamines is associated with slower processing speed, worsened attention and recall, increased confusion, especially in older adults. The cognitive effects are not just temporary. Long-term users often report memory lapses that persist even after stopping the drug. Dr. Shelley Gray, lead author of the 2015 JAMA study, noted, "These findings suggest clinicians should carefully consider the risk-benefit ratio when prescribing anticholinergic medications to older adults." A patient example. Rita's memory mystery. Rita, 72, had taken diphenhydramine nightly for sleep for nearly 6 years. Gradually, she developed what her family described as mental fog, forgetting recent events, getting lost on familiar drives. Neurologic evaluation revealed mild cognitive impairment. Her doctors, suspecting anticholinergic burden, stopped the antihistamines and initiated a brain-healthy sleep regimen. 6 months later, her MMSE, mini mental state exam, score improved by 3 points. While not a full reversal, the trajectory changed and Rita regained her confidence in daily life. What should you do instead? For ADHD focus support, behavioral therapy, structured routines, mindfulness, short-acting stimulants with regular drug holidays under medical supervision, natural nootropic support, e.g. omega-3s, B-complex, rhodiola, only with physician guidance. For allergies or sleep, second-generation antihistamines like loratadine, Claritin, or cetirizine, Zyrtec. Much less penetration into the brain, safer for cognition. Melatonin, magnesium, or calming herbal teas for sleep. Allergy-proofing your bedroom, using HEPA filters, and managing triggers naturally. Key takeaway: the medications we reach for daily, from focus aids to cold remedies, can quietly shape the future of our brain health. Amphetamines, when used improperly or long-term, may thin brain regions critical for decision-making. First-generation antihistamines, lurking in nightstands everywhere, may rob memory in the name of sleep. Now more than ever, we must weigh short-term relief against long-term impact. Your brain deserves that. Let's now move to number 6. First-generation antihistamines, the silent saboteurs of memory. Now let's move to a class of medications that many people keep in their nightstands or medicine cabinets, often unaware of the danger they pose to their cognitive health. I'm talking about first-generation antihistamines, a group of drugs that may seem harmless but have been quietly linked to memory loss, confusion, and even dementia, especially when used frequently over time. Common but misunderstood. What are first-generation antihistamines? These drugs are typically used to treat allergies, colds, hay fever, and insomnia. The most well-known examples include diphenhydramine, marketed as Benadryl and found in many PM sleep aids, chlorpheniramine, used in older cold and allergy remedies, hydroxyzine, often prescribed for anxiety or itching. These medications belong to an older class of antihistamines developed in the mid-20th century. They are sedating and often cross the blood-brain barrier, meaning they don't just treat allergy symptoms, they also interact directly with the brain. And that's where the problem begins. The dangerous mechanism, blocking acetylcholine. First-generation antihistamines have potent anticholinergic properties, which means they block acetylcholine, the same neurotransmitter we discussed earlier in relation to learning and memory. This disruption can cause short-term memory problems, confusion, difficulty focusing, delayed learning. The hippocampus, the brain's memory center, relies heavily on acetylcholine. Repeated suppression of this vital chemical has been shown in brain scans and autopsy studies to mimic changes seen in early Alzheimer's disease. What does the science say? In 2021, the British Medical Journal, BMJ, published a systematic review of 138 studies on the cognitive effects of first-generation antihistamines and other anticholinergics. The results were unambiguous. Prolonged use of these medications was significantly associated with increased dementia risk, especially in people over 65. A separate 2015 study in JAMA Internal Medicine added further alarm. It found that people who used strong anticholinergic drugs like diphenhydramine daily for 3 years or longer had a 54% higher risk of developing dementia. And in 2016, a study conducted at Indiana University School of Medicine using PET scans and MRI revealed that chronic users of these drugs had smaller brain volumes and reduced glucose metabolism in brain regions essential for memory and cognition. Real-life case: George's allergy trap. Take the story of George, a 68-year-old retired firefighter. For years, he used diphenhydramine every night for sleep and allergy relief. It was cheap, over-the-counter, and it worked. But over time, George started having trouble remembering conversations. He'd forget whether he'd paid bills or taken his medication. At first, he shrugged it off. But when he failed a routine memory screening at his primary care visit, deeper tests followed. The diagnosis? Mild cognitive impairment, possibly progressing toward early dementia. Thankfully, his doctor recognized the link and removed diphenhydramine from his regimen. He switched to non-sedating second-generation antihistamines, improved his sleep hygiene, and began cognitive therapy. Within 6 months, George's memory stabilized, and he felt mentally clearer than he had in years. Second-generation antihistamines, a safer choice. Unlike their predecessors, newer non-drowsy antihistamines do not significantly cross the blood-brain barrier. These include loratadine, Claritin, fexofenadine, Allegra, cetirizine, Zyrtec, though mildly sedating in some. These drugs are effective at controlling allergies without interfering with cognition or memory, making them far better suited for seniors or long-term use. Other risks beyond the brain. The side effects of first-generation antihistamines don't stop at memory. They can also cause daytime drowsiness, increasing fall risk, dry mouth and constipation, blurred vision, urinary retention, particularly in men with enlarged prostates. All of these complications are especially dangerous in older adults, where even a single fall or hospital stay can set off a cascade of health decline. Expert insight. What neurologists and geriatricians say. Dr. Malaz Bustani, a geriatrician at Indiana University and a leading expert on cognitive aging, warned in an interview with Reuters Health, even short-term exposure to strong anticholinergic drugs like diphenhydramine can reduce cognitive performance, and in older adults, these effects are magnified. He emphasizes that cognitive screening should be a routine part of care for any senior taking multiple medications, especially those with anticholinergic activity. What should you do? If you're currently using a first-generation antihistamine regularly, whether for sleep, allergies, or skin irritation, it's time to reevaluate. Talk to your physician or pharmacist about your medication list. Switch to second-generation options with lower risk for the brain. Explore non-drug alternatives for sleep, such as melatonin, magnesium, or cognitive behavioral therapy for insomnia, CBTI. Don't stop suddenly if the medication is used for chronic conditions. Always taper under medical supervision. Final takeaway. Don't trade allergy relief for cognitive decline. First-generation antihistamines may help you sleep or breathe a bit easier in the short term, but the price, for many, could be long-term cognitive fog or worse. The truth is, many people take these drugs unaware of the risks, and knowledge is the first line of prevention. It's not just about allergies, it's about protecting the most vital organ you have, your brain. Let's now move to number 7. Tricyclic antidepressants and statins, the overlooked risks to cognitive health. As we move deeper into the complex relationship between medication and memory, we arrive at two classes of drugs that are often prescribed for vastly different reasons. Tricyclic antidepressants, TCAs, and statins, yet both have been implicated in the conversation around cognitive decline. While TCAs are older antidepressants and statins are cholesterol-lowering agents, both interact with the brain in subtle but potentially significant ways, especially over time and in aging populations. Tricyclic antidepressants, mood stabilizers with a cognitive cost. Tricyclic antidepressants such as amitriptyline, nortriptyline, and imipramine have been used since the 1950s to treat depression, anxiety, and neuropathic pain. Though effective in some cases, their anticholinergic effects make them a serious concern for brain health, particularly in older adults. What the research tells us. A major study published in the BMJ, 2018, examined over 280,000 individuals and found that long-term use of TCAs was associated with a significantly increased risk of dementia, especially when used at higher doses or for more than a year. This aligns with findings from JAMA Internal Medicine, 2015, which showed that strong anticholinergic drugs, including many TCAs, increase dementia risk by up to 54%. The mechanism, again, involves blocking acetylcholine, the neurotransmitter essential for learning, memory, and cognitive speed. Dr. Maaz Bustani, professor of medicine at Indiana University and an expert on drug-induced cognitive impairment, warns, when we use medications that block acetylcholine, we are essentially mimicking one of the earliest hallmarks of Alzheimer's disease. Neurobiological impact. MRI and PET scans of patients on long-term tricyclic therapy often reveal reduced hippocampal volume, crucial for memory encoding, decreased cortical thickness, lower glucose metabolism in frontal brain regions. These are the same areas most vulnerable in early dementia. A real-life case, Eleanor's decision. Eleanor, a 74-year-old woman treated for chronic neuropathic pain and insomnia with amitriptyline, began experiencing word-finding issues, disorientation, and declining concentration. When her geriatrician evaluated her medications, the anticholinergic burden stood out. After transitioning to safer alternatives like gabapentin and sleep-focused CBT, her cognitive symptoms improved noticeably within 6 months. "I felt like I got my mental clarity back," Eleanor shared. Let's now move to number 8. Statins, heart protectors, or brain saboteurs. Statins like atorvastatin, Lipitor, and simvastatin, Zocor, are among the most prescribed drugs in the world. They work by inhibiting HMG-CoA reductase, an enzyme involved in cholesterol production, and are used to prevent heart attacks and strokes. But the brain is the most cholesterol-dense organ in the body. Cholesterol is vital for synapse formation, myelin sheath integrity, neurotransmitter receptor function. The controversy. Some patients report memory fog, confusion, or attention issues after starting statins. A 2009 report from the FDA's Adverse Event Reporting System prompted further investigation into a possible statin-induced cognitive impairment. A 2015 review in pharmacotherapy concluded that statins were probably associated with reversible cognitive side effects in some patients, especially with lipophilic statins, like simvastatin, that cross the blood-brain barrier more easily. But the science is still evolving. Dr. Beatrice Gullum, professor of medicine at UC San Diego and one of the most prominent researchers on statin side effects, stated, "The brain depends on cholesterol. Reducing it too much, especially in sensitive individuals, may impair memory, mood, and cognition." Mixed findings. Some studies, e.g. Neurology 2013, suggest statins might protect against dementia in people with vascular risk factors. Others, e.g. Journal of the American Geriatric Society 2010, show no benefit, or even harm, in cognitive performance among long-term users without prior cardiovascular disease. The truth likely lies in individual differences. Genetics, age, baseline cholesterol, statin type, and coexisting conditions all matter. A patient's experience. Victor's dilemma. Victor, a 68-year-old executive, was prescribed simvastatin after a borderline cholesterol test. Within 4 months, he experienced uncharacteristic forgetfulness and mental dullness. His doctor switched him to a hydrophilic statin, pravastatin, and adjusted the dose. The cognitive symptoms resolved within weeks. "Now I know to speak up when something feels off," Victor says. What you can do if you're taking a TCA. Review your medication list with your doctor. Explore safer antidepressant options like SSRIs, e.g. sertraline, fluoxetine, which carry a much lower risk of cognitive decline. Consider non-pharmacological support, psychotherapy, exercise, light therapy, and sleep optimization. If you're taking a statin, don't stop abruptly. Statins save lives by preventing cardiovascular events. Monitor for cognitive symptoms and ask about alternatives. Inquire about switching to a hydrophilic statin, which has less penetration into brain tissue. Adopt lifestyle changes, Mediterranean diet, exercise, stress management to support both brain and heart health. Key takeaway: just because a medication is old or common doesn't mean it's risk-free. Tricyclic antidepressants may trade short-term mood relief for long-term memory erosion. Statins, while crucial for many, may impact brain chemistry in subtle but important ways. The goal isn't fear, it's informed use, personalized care, and never accepting cognitive decline as the price of treatment. How to protect your brain while managing your health. Cognitive decline is not an unavoidable part of aging, and your medications shouldn't silently accelerate it. The truth is, many life-saving drugs can carry unintended effects on brain health when used long-term, especially in older adults. But the solution isn't fear. It's informed action. If you're taking any of the 8 medications we've discussed today, do not stop them suddenly. Instead, speak with your doctor. Ask whether there are safer alternatives, whether doses can be adjusted, and how your brain health can be monitored over time. Support your brain through nutrient-rich, anti-inflammatory foods, daily physical activity, quality sleep, social connection, regular cognitive checkups, just like heart and blood pressure screenings. As Dr. Lisa Mosconi, a neuroscientist at Weill Cornell Medicine, reminds us, the same lifestyle choices that protect your heart also preserve your brain. Your brain is your greatest asset. Guard it wisely. Stay curious, ask questions, and make every decision, including medication, from a place of empowerment, not assumption. If this video helped you or someone you love, please like, subscribe, and leave a comment below. Let's build a community where brain health truly matters.